Well, I'm doing this video again because I'm doing this on my phone, and then somebody called me and knocked the original video out. But I want to do a video of this hospice called Connecticut Hospice. It's a real peaceful place, and they really, they care about making patients comfortable. As you can see, it's very nice. There's a seagull up there. And this is the backyard of Connecticut Hospice here in Branford, Connecticut. It's real beautiful. I mean, you can see all the nice, beautiful houses. People that actually live facing the water. Some seriously lucky people. Look at that. There's a guy out there in the beach. A little bit of beach. Let's see who donated this. There you can see Connecticut Hospice to Norma F. Prime. I don't know how to pronounce that. Promenade. The patient and family always comes first. 2013. Hospice.com. You can see here we go walk out. Some benches here. Somebody left some rocks here too. Probably some family. Maybe some kids. See right there. Left some rocks here. And there's that little island connected with like a sandbar. You see it? You can probably walk out there. But they got that gate locked, so you can't go out there. It's, probably for legal reasons, insurance reasons, If we look, this is a very nice place. The inside is very neat. You can see right there, that's the Connecticut Hospice in Branford, Connecticut. See, that's nice. I come out here. I'm gonna bring the patient out here probably and sit them out here so they can enjoy the water. You can imagine what this property is worth, being that it's facing the water like this. You can just imagine a real estate developer. This would be a real estate developer's dream right here. Must have had some type of event right there. It's a nice breeze. We're not in October yet, so it's not really cold. A nice strong breeze. Imagine living out here facing this water. You probably don't need any air conditioning. This breeze would. So right there, you would save some money on air conditioning. You can see some boats out there. I wonder if there was a pier right there. You see where the wood is sticking up. And you can see, might be a yacht or a boat just riding by. Of course, I did this video before, but I had to erase it because the phone call cut me off. But there's Connecticut Hospice. Our father's in room 227B. I don't know whether there's some ducks or some geese flying by. This is designed for some peace. I put do not disturb, but I guess it's, I don't know if these notifications are popping up on my video here. You can hear the seagulls. Oh, sitting on that pier. I don't know if people can see that. Oh, this I was talking about, this brick. I wonder if everybody that has passed away is on this bricks, You got the dates. I don't know if when people passed away, I think they could. It starts all the way with that not statue, but even on the other side, you can see it's two sides, creating like a walkway. I don't know how far they'll take it. They'll keep probably going. All of this is like their property. You can see the beautiful water. Nice sunny day today. A little breezy, but there's some people on the water. You can see all the beautiful houses, all of them facing the water. Some very lucky people. Very lucky people. I'm not jealous of them. God bless that they have the resources to buy houses like that. They're not mansions or anything, but you can see 3 of them right there. Then a community, looks like a little town, but this is Connecticut Hospice, like I said, in Branford, Connecticut. See all the people enjoying the water out there in their boats. Beautiful houses right there. All of this is probably Connecticut Hospice property. But this is where my father is right now. And like I said in the other video, which I had erased, oh, there goes the boat going by. He's in here now because he's 89 years old and he has like serious asthma, COPD, some other health issues. But like I said, the story of him is he's been intubated like 18 times. And they've told us he was going to die like 3 times in the past. 25 years ago, 20 years ago, 15 years ago. He came up with serious issues where they said he was going to die, and he pulled through. And with all his health issues, intubated 18 times, he's 89 years old. I guess the hospital told my sister when he was in the hospital that he's the $6 million man because they can't believe that he has survived all those types of illnesses that he's had. He was in the hospital one time for 11 months. I remember that. 11 months he was in ICU. I don't know if it's because he loves to walk. Now he can't walk that much. He's just in the house. But he used to walk the neighborhood. He used to walk for an hour. And he was real skinny, so maybe that's the reason that he was able to survive all those. You know, he was a lot of health issues, but he was fit. He's still skinny, but here you can see it's inside. I don't think they'll let me video the inside. I doubt it. But it's real nice inside, too. Let me tell you, when you're at hospice, if you push that button for the nurse, they come quick. I mean, they're like, I'm telling you, they treat all the family like they're family. That's their job. Even the nurses' aides, the nurses, everybody. Kitchen, anybody that works there, I guess they tell them, you know, they probably fire somebody that's mean. We had either choice of putting them in a nursing home or hospice. And a nursing home would have probably killed them off pretty quick. Because over there, I mean, nurses' aides, I'm not saying all of them, but, you know, a rare amount were very mean and brutal with the patients. But I don't think there's been any nurses' aides here or doctors or nurses that have been mean to my father or anybody. I think any hospital should be like that. Should be like a hospice where, not that they're having people waiting for people to die, but they should be like a hospice where they treat everybody nice. I know there's some mean patients too, but still, even when I was in the hospital a couple months ago for twice, I was 3 days in 2 times, and you hear patients screaming and complaining. I understand sometimes that stresses some of the workers out, but let me tell you, the way hospitals, they should be nice. Even though they're not a hospice, they should learn something from a hospice. If you have an employee, I remember my father was in the emergency room this time. The nurse was a male nurse, and my father needed a breathing treatment, and he'd look at the blood gas, and he's like, "Oh, he's fine," or the oxygen saturation. My father was literally there gasping for air, and the guy couldn't even see that he needs some type of comfort. You can't give him a breathing treatment. Just give him a fake breathing treatment with some mist coming out of it, for he could think he's getting one, because he was panicking breathing, because his lungs are so damaged that he could only take, it's like breathing through a straw. And I had to ask the guy multiple times, can you please give him albuterol? That's what they give, breathing treatment. Albuterol. I don't know if that's a plane up there or a kite. It's gotta be, because it's moving slow. I don't know if that's a plane. Oh, no, I'm sorry. That's a plane. That's a plane dragging one of those commercial things. I hope that notification is show. That's because I got to go to the heart doctor 12:30. I don't know if they canceled it or what. So I'm saying you got to take care of yourself, because me, I'm a little overweight. Had high blood pressure, didn't know it, didn't take care of myself. And I'm telling myself, and I'm still eating like crazy. I'm like, I got to take care of myself, Started exercising and stuff. I'm not a grandfather yet, but I want to be a grandfather. And it'd be nice so I got to start taking care of myself, taking this shit seriously, Because you don't want to be in such a bad shape where you can't walk. So you got to I'm 51. So I got to get my bones nice and strong. When I get that age, I'll be able to still walk and move, Well, that's it for now. I was trying to keep this at 10 minutes. This is Connecticut Hospice, Branford, Connecticut. Give them 5 stars out of 5. And a bonus star for going beyond, way beyond, way beyond, the way they treat patients is like incredible. All hospitals should be like this. And like I said, they get 5 and 1 bonus star for being, all the nurses' aides, the nurses, everybody is like super friendly. I'm pretty sure if they're not friendly, they get fired. That's what I think happens. So these workers know that either you be very friendly or you're going to get fired. Well, that's it for here. Thought I'd vlog this. Comment, subscribe, and share this video. This is Connecticut Hospice in Branford, Connecticut. Peace out.